Now we have two questions about you know about what. One of them is a 53-year-old woman who comes to the office for removal of multiple nevi. On injection of lidocaine, which of the following signs and symptoms is most likely to suggest lidocaine toxicity in this patient? Is it bronchospasm, hypertension, tachycardia, tinnitus, or urticaria? And the answer is D. Tinnitus. Signs and symptoms of lidocaine toxicity include dizziness, agitation, lethargy, tinnitus, metallic taste, perioral paresthesia, slurred speech, euphoria, hypotension, and bradycardia. Tachycardia is not a sign of lidocaine toxicity. Bradycardia is more common, and bronchospasm and urticaria are not signs of lidocaine toxicity. According to the other answer, about a 35-year-old woman who undergoes suction assisted lipectomy of the bilateral arms using a tumescent technique. A total of 500 ml of aspirate is recovered. She is discharged home the same day and returns to the emergency department 8 hours after discharge. Lidocaine toxicity is suspected. Which of the following symptoms is most likely in this patient? Is it anisco, anisocoria, or it is a petechial rash of the neck and axilla, or it is supraclavicular tachycardia, or tachypnea, or tinnitus? As we mentioned before, it is tinnitus, the CNS, central nervous system problems, then the cardiovascular problems. Although safe doses of lidocaine in tumescent solution can reach 35 milligram per kg, lidocaine toxicity is still a risk. Peak plasma levels of lidocaine when injected into fatty tissue occur uh, 10 to 14 hours after infiltration. Lidocaine toxicity symptoms include neurologic and cardiovascular toxicity in the early stages. The complications are primarily neurologic and can include slurred speech, restlessness, tinnitus, and a metallic taste, as well as membrane numbness of the mouth. As the concentration increase, the neurologic concentration become more severe and can progress to muscle twitching, seizures, and cardiac arrest. Treatment of lidocaine toxicity is supportive. A petechial rash of the neck and axilla is a typical sign of fat embolism, and tachypnea is a typical sign of pulmonary embolism. Aniscoria can be a benign finding, although if it is a new finding, it is suggestive or Horner syndrome or a brain aneurysm. Supraclavicular tachycardia (SVT) refers to tachycardia that occurs above or at the arterioventricular node, uh, uh, para, paroxysmal SVT, atrial fibrillation, and Wolf Parkinson White syndrome are the most common form of SVT. SVT can cause syncope and long-term cardiac damage. According to this, uh, please subscribe to my YouTube channel. Concentrate more about the value of the questions more than the direction of the video. Please forgive me because I don't have too much time. Share this video with your friends who like to submit to plastic surgery exams, and thank you. Make like of the video. Please watch the next video for another questions.